So as we all know, Brampton has a population of about 650,000, and it's growing at an enormous rate, 3 times the national average. I think what is important here is perspective. Ontario has the second lowest healthcare funding per capita in Canada, and Brampton has the lowest healthcare funding per capita in Ontario. Taking those two comments together, what that means is that Brampton has one of the lowest per capita funding in our country. We see some of the highest chronic disease morbidity, and we are the busiest and most grossly underfunded hospital in Canada. Given on any given month, our ER is either ranking the most busiest or the second most busiest in the country. I just will be referring throughout the presentation to the Peel Memorial Urgent Care Centre and to the Brampton Civic ER Department, and I wanted to just provide clarity to everyone here as to what are the key differences between those two facilities. The Peel Memorial Urgent Centre is essentially a glorified walk-in clinic. The hours are extremely limited, and the services provided there are similar to services provided in other community urgent care centers, and even in some family doctor and in some actual walk-in clinics. So there's nothing elaborate in terms of the care provided in that facility. Our emergency department is seeing a very high acuity of patient concerns, and there is a clear distinction between what should be seen at either facility. Now, I bring this to your attention because there was recently a delegation from Osler where the CEO had mentioned that while the patient profiles are actually very similar for both facilities, that should be extremely concerning to council because they shouldn't be. And if the patient profiles are very similar, well, that's an indication that we're seeing patients far more acute that should not be seen at the Peel Memorial site, but should actually be seen in an ER facility. I can tell you that every single day we have patients that are transported by ambulance from the Peel Memorial Centre to our Brampton ER. Every single day. In a life and death situation, seconds matter. Every single day we have patients that are often stabilized because they can't be transported immediately. They're stabilized and then transported to the Brampton ER. I personally and my colleagues personally have had patients who have been unaware of the timing of the Peel Memorial Centre and have often arrived to closed doors in an emergent situation where they have then panicked and called EMS, or they have themselves attempted to actually drive to the Brampton ER. Similarly, oftentimes when patients arrive, sometimes they're so acute that there is no time to stabilize and EMS is called immediately. So these are conditions that should not exist. These are extremely hazardous to the residents of Brampton, and these are concerns that have not been addressed by medical leadership here in our city. Brampton's only hospital is the epicenter of Ontario's healthcare crisis and the hallway medicine crisis. It is in constant code gridlock. Initially, code gridlock a few years ago used to occur majority of the time. Now it is the new normal. Code gridlock is the normal stance. What that means is when patient needs exceed hospital resources. And oftentimes you will see patients lining hallways for as far as the eye can see, and elective surgeries and elective diagnostics are often canceled because there is nowhere to place those patients post-operatively or post their diagnostic procedure. What should be extremely alarming to council is that in recent months, code gridlock has escalated to such levels that we now have a new category called extreme code gridlock. Initially, code gridlock would be called when there would be approximately 30 patients in our ER that were admitted to the hospital but had no bed to go to because there was no bed upstairs that was available. So patients were admitted to the ER. And now extreme code gridlock refers to that number at 50 and above. So when there's more than 50 patients that have been admitted but are in the ER because there is no place for them to go. At times, that number has gone even higher than 60. We are in constant code gridlock. That is our normalcy. That is a normalcy that is impossible for frontline nurses and for frontline doctors to function in, and that is a normalcy that does not allow for any quality of healthcare delivery. Our ER currently sees more than 140,000 patient visits every single year. It's only built and funded for about 90,000 visits annually. We've had a huge spike, approximately 35% since 2011. To put this into perspective, the ERs in many of the academic centers in Toronto, such as Sick Kids Hospital, Sunnybrook, Michael Garon, they see an average of 50 to 60,000 patient visits annually. We are seeing double to triple their amount with only a tiny fraction of what their funding and resources are. This is unsustainable. We have more than 5,000 patients being seen in our hallways every single year. Every single year. And I can't stress enough that what's really important to realize is that being in a hallway is not simply about convenience. It actually impacts patient care and leads to greater disease morbidity and greater disease mortality, and it impacts patient outcomes. Patients treated in an ER hallway are at a greater risk of actually acquiring any sort of infection. They are also at a greater risk of having the need for a longer length of stay and taking longer to actually get better during their stay. There is an increased risk of confusion and actual delirium for our seniors. Overall, it is bad for healthcare delivery. We are putting patients in a situation where we know their outcome will be worse, and there's nothing that frontline doctors and nurses can do to actually rectify that. Our hospital consistently is well beyond 100% capacity. For a hospital to operate at a decent level, that number should be consistently less than 85%. We have never been there for years. The Peel Memorial site, known as the Urgent Care Center, as I said, is a glorified walk-in clinic. It's really important for the council to realize that it is nothing more than a glorified walk-in clinic. There is absolutely no specialist services available there. There's no inpatient beds. It is a glorified walk-in clinic. It also has extremely limited hours. Of note, the Ford government cut hours for this facility. In July of 2019, it used to be open until 10 p.m. What is astonishing is that this cut occurred just months after the same government increased LCBO hours in our community and across the province, which shows you the ridiculous priorities of this government. So they are putting alcohol availability and alcohol access above and beyond essential healthcare services. This facility sees approximately 75,000 visits annually and is only funded for 10,000 visits annually. It is operating at unbelievable levels of nearly 600% volume. This image is what circulates in the triage and waiting room area. As you can see, it is advertising MAID, which is medical assistance in dying, which is a term used in Canada to refer to euthanasia and physician-assisted suicide. This is a screen on large TV screens that appears for patients who arrive there desperately seeking medical attention, and it is being advertised as the only means to end suffering. There is absolutely no mention of palliative care. I have spoken to colleagues across the province, and this does not exist in any other facility, in any other hospital in our province. Patients in the most grossly underfunded, city, and our entire province are being baited for euthanasia. This is a disgrace. How did we get here? The William Osler leadership has been a huge factor in this. In November of 2001, the Ontario government approved development of a new hospital using a P3 approach, which is a private-public partnership. In August of 2003, there was a 25-year deal signed between Brampton William Osler leadership and the Health Infrastructure Company, which is a private sector company which includes many service providers ranging from maintenance to laundry, etc., in terms of service delivery that's non-clinical for a hospital. In December of 2008, the Ontario Auditor General did a lengthy analysis into this deal and actually released a report publicly, which found that P3 costs taxpayers $194 million more and $200 million more in further interest charges. So taxpayers paid $393 million too much for a hospital that was $614 million. The Auditor General further found that Brampton William Osler that the corporation had overstated the cost of the government-built hospital by $289 million. And this was based on their own consultants' reports, which they never questioned. The province also failed to conduct formal analyses, and they failed to determine that the market was not sufficiently large or competitive enough to justify a P3. Now, this is crucial because it's my understanding that the same corporation was granted $500,000 by the province in early 2018 to start early planning of phase 2 of Peel Memorial. And it's not until late 2019 that they actually submitted something to the province. During those nearly 2 years, they did absolutely zero community consultations. There was zero consultations with community physicians and nurses. There was absolutely no consultations with the community. The community still does not know what was submitted to the province, even though those reports were funded by public taxpayer dollars. Now, this should be very concerning given the facts that transpired to bring us to our current healthcare nightmare that exists. There needs to be greater transparency and there needs to be greater accountability from William Osler to our community and to City Council.